All right, here are your acute phase exercises for the wrist and hand. We're gonna start with the range of motion. You're gonna do your wrist flexion extension here at the edge of the table or on the armrest. Wrist flexion extension, active range of motion, radial ulnar. You can also do these on the table, radial ulnar, finger flexion extension, abduction, adduction we typically do on the table, or they do freehand like this. Finger scrunches is just taking a towel and doing finger flexion. And then the wrist alphabet would be with your wrist hanging off. I'll show you with this hand. And then doing your ABCs with the wrist. For isometrics, you just use your other hand, doing wrist flexion, wrist extension, again with the pressure in the palm, not the fingers. Radial deviation, radial deviation, ulnar deviation. Isometrics, for the finger, flexion, extension, abduction, adduction, right? Adduction always going towards the third. So adduction will be here, abduction is here. You can bias whatever finger digit you want, whether you want to do your digitorum profundus or digitorum superficialis. We have your flexor tendon glides, position 1, position 2, position 3, position 4, position 5. And then you're going to go back to 4, 3, 2, 1, 2, 3, 4, 5, 4, 3, 2, 1. Your extensor tendon exercises are a little bit different. You start here. A, B, C is with the wrist, D is with the thumb, 5 is the pinky, and then F is over pressure. So it starts with A, B, C, D, E, and F. Those are your flexor and extensor glides. Your finger blocking exercises, you can either just keep your hand still and block which finger you want to do. You can block this way, you can block and do this way, or curl, whichever finger you want to block. And you can do the same thing for extension. You're going to hold your finger off the edge in extension, block your finger and just go up, or block your digit, or block at the metacarpal. To stretch your interosseous, you're gonna have your hand flat on the table with the MTs extended, and you can stretch here, stabilize with the other hand. So I'm stretching the abductor, the dab, because this you're gonna go here. So this is in the abduction, so I'm stretching the adductor. So I'm stretching my pads when I'm doing this, stretching my dabs when I'm doing this. You may or may not feel a stretch with these. Patients with very restricted finger motions will feel a stretch with this.